In a world where access to health services too often depends on where you grow up, Living Goods brings a new model of healthcare delivery to end needless death and suffering.
In the countries we work, somewhere between 50 and 100 out of 1,000 kids will fail to reach their 5th birthday. There's only 3 or 4 sort of major causes of this: diarrheal disease, malaria, and pneumonia. What is shocking is that all of those things can be addressed at extremely low cost. But the barrier is effectively delivering what we know works. The big challenge today is that almost every country in Africa has some kind of community health network, but they tend to be grossly underfunded, understocked, and undermanaged.
Mimi nilikuwa na ugonjwa wa malaria.
And so the challenge is, how can we reinvigorate this idea of door-to-door healthcare, make it both more impactful and financially viable in places where financial resources are extremely limited? I'm thinking about that and I go, wait a minute, hold the phone. Isn't there a business model that excels at that? And you start to think about Amway and Avon and Tupperware. Further research, I actually went out and enrolled as an Avon lady and tried to learn it from the inside. In a sense, what Living Goods does is quite simple. We recruit, train, and support networks of community health promoters who go door to door every day, teaching families how to improve their health and wealth, and then making a living by selling high-impact health products like simple treatments for malaria and diarrhea, healthy fortified foods, high-efficiency cook stoves, solar lights, and water filters.
Kodi! Sweetie, nkuchalirako bankuyitako wizi. Je baleko mukwano. Wanju sweetie.
Most of the health centers are very far. And these mothers, these fathers do not have access to these health centers.
Oyisawe dakika ngana oba 5 olyoka kimwenga tagenda kuddamu kulya kintu kirala kyonna olyoka kimu.
But with the Living Goods, we are always there for them. Anytime they come across you, you are ready, you have the medication, you give the treatment.
Story maro yita ne lu thena bo matia hu ko taw ni de ye de de ta sin ne phyo lai me so ni ta hu aw ma ne de thai ni li ya ta a be no ai do di ma.
Every agent works as an entrepreneur under the Living Goods brand. We typically partner very closely with a local government. So where we operate, we are the government's community health army. And now, perhaps most importantly, they get a smartphone. And that smartphone has a Living Goods designed application on it that can help them with a guided diagnosis of childhood diseases that enables them to register and support pregnant women and reminds them to follow up with those customers.
It has changed the community from what it was, especially the community we have worked. It has changed the community.
Living Goods community health promoters are reducing child deaths by 25% for less than $2 a year per person. By the end of 2016, along with their partners BRAC and PSI, they will have more than 4,600 community health promoters, serving a population of more than 5 million people.
I think within 10 years' time, it's possible that every community who needs a community health worker can have one to make sure that that kid doesn't die of malaria or pneumonia or something else ridiculously simple that they needn't die of. And I think anyone who's a parent or a human can understand that.
From Living Goods, Chuck Slaughter.
Deep breath. I'm a father of 3 boys. 4 years ago, in the dark of night, my youngest son, only 4 years old at the time, fell mysteriously ill. We did what most people would do where I live. We called in Vice Nurse. She promptly identified his symptoms as grave and sent us hurrying to the emergency room. There he was diagnosed with a condition that's deadly if ignored, but easily treatable if caught in time. If my son were born in rural Uganda, he would not be with us today. So why shouldn't all children have access to the same care as mine? The 20 richest countries spend an average of $6,000 a year per person on health care. The 20 poorest spend less than $40. But here's what I really don't get. Why in so many poor countries are the poorest people in the healthcare system, village health workers, expected to volunteer without pay? Is that right? Is it sustainable? No one ever suggests that the Minister's Finance should work for free. At Living Goods, we found a way to empower my heroes, these community health workers, to make a difference and make a living. Living Goods and our amazing partners have proved that this model reduces child deaths by 25%. But most importantly, we're delivering this service at a value that is feasible even in low resource settings and scalable, costing less than $2 a year per person we reach. Our courageous health workers don't care for their neighbors just to make a living, but isn't it obvious they can't do it without making a living? It turns out that the right thing and the smart thing happen to be the same thing. Now, we're committed to spread this idea far and wide like a virtuous contagion. By the end of this year, Living Goods and our partners will serve a population of 5 million. That's greater than the population of Ireland, but it's just a start. In 10 years, we want to multiply that tenfold and reach 50 million. You know, there's a myth about entrepreneurs that they conjure miraculous new models from whole cloth. In truth, we're all watchers, we're learners, able adapters, clever combiners. We build on and amplify the work and ideas of others. And Living Goods' impact is only possible because of the inspiration that we draw from other innovators, partners, and funders, many of them members of the Skoll tribe, like BRAC, SIF, Partners in Health, Medic Mobile, and yes, even Avon, all the way back to the first midwife who reached out to help a neighbor in a moment of need. Now it's time to pay it forward. At Living Goods, our vision of the path to large-scale change on the scale of the problem, demands being the source of inspiration to others. We will do whatever it takes to help health workers around the world and the institutions that support them learn from us, just as we will keep learning from them. Let ours be the generation that refuses to accept that whether a child lives or dies is determined solely by the postcode that they are born in. So I thank you all. I'm so humbled to stand alongside these 5 absolutely amazing fellow honorees. And I'm deeply honored and grateful to join the Skoll community of these inspiring innovators spreading world-changing ideas far and wide. Thank you so much.